So how's it going, guys? I wanted to talk to you guys today about a few different recovery techniques. I get a lot of questions about how to recover faster, what ways can get me back in the gym. I have an injury potentially that I want to recover from, or I want to be proactive and not get any injuries. So how can I do that and things of that nature? So first and foremost, one thing that I always tell everybody to do is stretch, right? So post-workout, prior to your workout, do some moderate stretching depending on what type of exercise you're doing or performance that you're doing or sport that you're doing. Always stretch for that said type of exercise, sport, or whatever endeavor that you're getting into. If I am going to be doing Olympic lifts, I'm not going to be stretching as if I'm about to go and potentially do yoga. That's not how I want my muscles to be lengthened. I want my muscles short and snappy still when I'm going to do those powerful movements like that. The last thing I want is for my hamstring to be completely elongated and not able to snap when I need to get all the way into a full snatch. Dynamic warm up, even some moderate static stretching and things of that nature. But I really am a strong advocate for the new wave of apps that are stretching, like ROMWOD and things of that nature, because they're allowing the stretch to be held for a longer period of time rather than our normal 10 seconds. When we're looking for long, what's happening and occurring during those long stretching periods is that the gluteal tendons, your GTOs, are overriding your muscle spindles. So if you think about when you're maybe bench pressing, right? Your body has its own safe mechanism. So its safe mechanism is those GTOs overriding the muscle spindles so that you don't create an injury. So if I'm bench pressing and I get to a point where I'm straining and I'm struggling right here at this position, I got it halfway off, and then I just completely fail, right? That's your GTOs overriding the muscle spindles and saying, hey guys, if we keep trying this, we're potentially going to hurt ourselves. So that same approach needs to be developed in our stretching technique. We need to hold the stretches for a period of time to where the muscles are at a complete relaxed state. So holding it for your minute or plus is what's going to allow that to happen, and that's going to create that stretch that you want, that's going to alleviate the adhesions and the knots that people say they're having in that muscle part. It can help intensify your mobility or aid your mobility, your extensibility, your elasticity in muscles, and your full-fledged range of motion, guys. So we have to think about all of those different wickets. Everybody's so eager to think about mobility. Well, what about functionality, or what about elasticity, right? We need that muscle to be able to retract and come back the same way that it's stretched to come back. Mobility is a big thing, but there are some other things that we need to be focused on as well and make it one big broad spectrum. So stretching is the one thing that I'm going to definitely approach to you guys and let you guys know first and foremost. Next is an old school method of ice therapy, right? It's a cheap man's version of taking away some inflammation. Your body's created, when we're exercising, we're in a constant catabolic state, right? So our body's consistently breaking down. So how do we create this anabolic state of us building back up? So we need to take away that inflammation. Now, I'm not one to tell you to take away the inflammation immediately, post-workout, go straight and ice yourself. No. The blood that's going to that area that causes that inflammation has a lot of nutrients and vitamins and things of that nature and minerals that your body needs to heal and get back to that anabolic state. So I would suggest that you think about that maybe for 36 to 48 hours post-exercise or post-activity or post-injury even. Allow that inflammation, allow that blood to get to that area, reach and do exactly what it's supposed to do. Now, overabundance has been known to happen, and that's where that inflammation or that swelling comes, because we're actually getting a little bit too much of what we need. So that ice bath, yes, you can get into that ice bath, and it's going to take away some of that inflammation. It's going to constrict those blood vessels and not allow so much blood to be dispersed to those set areas. Once the inflammation goes, a lot of times pain goes away, because inflammation can create irritation underlining in that muscle area. It might be too much. That area is expanded too much because it's too much blood in there and things aren't maneuvering and moving around the right way. So icing can definitely help. Now, one caveat to that, or my next one that I'm going to tell you guys, is cryotherapy. Now, icing is a good thing, but like I said, it's more so the cheap man's way of doing this next thing, which is cryotherapy. And why I say the cheap man's way, because cryotherapy can get a little pricey per half hour, per 20 minutes, or the hour. but it's well worth it. And why it's a little bit better, or actually a drastic amount better than sitting in a cold tub, is when you sit in the cold water, your body tends to go through this cycle of reacting to the cold to your skin, as opposed to with the cryotherapy, it's dry air, so it's allowing to penetrate all the way down through almost to the bone, to the core of your body, and really get into that area, or your entire body. If you're getting a full body cryotherapy, you can really take away a lot of inflammation. Again, I'm not for that happening immediately after workouts. It depends on what you have going on. If you're in an event and you need to be able to be right by the next day, yes, you can go ahead, do your event one day, get a nice cryotherapy to take away some moderate inflammation so that you're not as sore, and then go on to the event the next day, maybe having what we're going to talk about next, is the massage. So maybe having some massage therapy. So there's variations, different modalities in the massage community. I'm a massage therapist. Depending on if it's pre or post workout or just in between sessions and things of that nature, I'm going to do different variations. So don't allow your massage therapist to just do the same thing every time you come in. If I'm going to be going into an event, I want something that's going to stimulate my muscles and get me worked up. If it's after an event, I want my muscles to relax. If it's in between events, I want to do some lactic flushing. So I want that whole area to be able to be drained and flushed out, lymphatic system to be flushed out, so that we're able to go on and I don't have too much lactic acid going on in those in that lymphatic system, and I can push through. So massage therapy is a big thing. If we're having injuries, massage therapy can be changed up a little bit different and kind of hover over that physical therapy line. I am not a physical therapist by no means. I don't take credit for that, but it can start adding in a little bit of exercise movements to help with that said injury, to go along with it. So manual manipulation and manual therapy, actually getting in there, using tools, your hands, all of that stuff, but also coupling it with some exercises that are going to help either strengthen up the weak muscle, relax the overactive muscle, or vice versa. Guys, we have a plethora of things. We got rock tape, kinesio tape, we got rock blades, cupping. There's a lot of different modalities underneath the massage therapy. So I think we hit 4 different ones. We had ice, stretch, cryo, massage, and probably my favorite, the last one, the one I'm gonna end with, is contrast therapy. So we all know if we have back pain, a lot of people throw a nice warm pack on their lower back just to help relieve the pain, and it kind of gives you this warm and fuzzy feeling, this sensation of a sigh of relief, right? So that's always a good thing with the warmth. Also, that warmth is bringing in more blood and nutrients to help recover and help that area heal, and then we go ahead and we flip-flop. So the contrast therapy is warm, cold, warm, cold, warm, cold, always ending in cold unless it's pre-event. You always want to take away that inflammation. So that's my way. There's more than one way to skin a cat. If you heard something else, you go and do your research. But what I've been taught is always end with that cold. So I would suggest starting off maybe doing a 3-minute cold shower, 3-minute cold ice tub, 3 minutes in the cryo. However long you can do that cryo, 3 minutes might be a little longer for your first session, but I try to do a 1-to-1 ratio when I'm telling my guys. So I may have them go and sit in an ice bath for 3 minutes, hop out. If they're somewhere and they can go right into a sauna, a hot tub, preferably a hot tub or a sauna. Hot tub just because it's a little bit more pleasing to the body. It's not as draining as that sauna or steam room. But definitely hitting those 2 wickets back and forth will stimulate your body and have a nice recovery time. And it can probably dumb down your recovery time, maybe 24 to 48 hours, and allow you to be able to bounce back a little 24 to 48 hours faster than you normally would. So that can change a lot of people's programs and training modalities and help push you to the next step. So hopefully, guys, this was super informative. If you're a client of mine and you know you've gone through this, you know that I always give you guys homework to go home with. When I say homework, it's going to be some home play that you need to go home to help me help you. is never just coming in. You should never go to your massage therapist and go home with no additional work, because that one treatment that you got is not going to alleviate the reason why you went to that massage therapist. And sticking with your contrast therapy, being resilient with your ice therapy, your cryotherapy, and 100%, guys, stretching prior, till, and post workouts will help drastically, man. So don't think that because stretching is so mundane, or it's most common thing, that it can't be effective. It is a highly effective procedure when it comes to recovery. So stretch, apply all of the exercises that are needed with recovery, and hopefully you guys have successful training cycles. Hopefully you guys have successful sporting events and anything else. If you guys have any issues, don't hesitate. We're Evolving Fitness Therapeutics. You can come here, get some more information, subscribe to our YouTube channel. We're going to bring you a lot more information, guys. So hopefully that was a great one for you.